The more times your little one is put on antibiotics, the more times they're put on inhalers, the more times that stress, that sickness, and that perfect storm is driven into their system, the more that increases the likelihood, almost guarantees, that your child is no longer a 5-day or 10-day customer, an antibiotic or a corticosteroid script, but now they become chronically ill and dependent upon the medical system and medications. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. All right, parents out there, welcome to another episode of the Experience Miracles podcast. Let's cut right to the chase with this one here today. If I had made this episode with this title and these three truths, these three reasons that we're going to tackle today, and really the whole golden thread, the take-home point to this conversation, if I had put this out there on a platform like this 15 years ago, without a doubt, the majority of people receiving it, listening to it, and finding it would have found this conversation shocking. They would have called it controversial. They would have called it a conspiracy theory for sure. Now, all of that has shifted significantly in the last 10 to 15 years. I bet when you saw the title of this episode, it resonated with you massively because you have experienced some major letdown, and there's nothing else to call it other than absolute abysmal failure from the conventional medical system, which for our kids is really one word, the pediatrician. And then when the pediatrician can't find answers, doesn't even really look for answers and root causes, that'll be step number one here in a second, they send you on down to every other medical specialist, but the results are the same. Right? We become disappointed. We become disenchanted. We become frustrated. We become just disheartened, angry, just exhausted, all of the things with the conventional medical system. And so in today's world, the majority of us as parents actually agree with these truths, agree and have experienced these three things probably ourselves. And so now the truth is, the people who think this conversation that I'm having here with you today is a conspiracy or is controversial, they are in the minority. Now, if that's you, I want you to give me a chance to listen to this one all the way through. Or maybe you're halfway between those two viewpoints. Maybe you know that there is a whole lot of life-saving, good intervention in the pediatrician's office, in the conventional medical system, inside hospitals. Maybe that's what you believe. If that's the case, you're right. You're absolutely, positively telling the truth. I watched conventional medicine, surgeons, neurologists, all sorts of medical specialists save my son's life, but then I lived right in the thick of what they struggle with as well. They had no plan on how to get him healthy again once they put the fire out. They had no clue on how to actually restore health to his brain, his nervous system, and his body. So this conversation is not a conspiracy theory. This conversation should have no controversy tied to it at all. This conversation needs to get out to the world. So please lean in, soak this one up. And as always, we ask that you share this podcast with all the moms, all the dads, all the other providers that you know lean in this direction, whether they're all the way in and have already crossed this bridge and know that they need to go a different direction with a different doctor to get different results, aka good results, good health for their children, or if they're just beginning their journey and you know that this podcast can be that guide, be that bridge to get them across this confusing, frustrating, perplexing gap that exists in healthcare for so many families still today. I promise we will clean up that confusion and we will get you across that bridge with real truth, real science, real facts, and then real action steps to get the job done when we get through this one. Now, my chuckle begins already there for you as I listen in, because I know I'm going to have, like always, like every episode of the Experience Miracles podcast, I'm going to have a real serious conversation where the beginning of the episode, well, once I get to the actual beginning. We're still in the introduction here. If you've listened to a few of these episodes already, you know that when I say long story short, the length of the podcast just doubled via one story, because one story becomes 9. And then we get back on track once we get rolling. But right in the introduction, before we get into my not favorite job, which is to share the bad news, which really shines the light on the problem we need to solve, that then gets us to my favorite part of my job, the good news, the solution, the action steps, the answers, and the drug-free solutions you can go after for your family. Once you see that you might need to take a hard left and take a new path and find a new doctor to lead your family to that place. But let's have some fun. Let's share with you my personal 3 favorite conspiracy theories. See, we have a little fun thing inside PwC. So every Monday morning, we have a 90-minute clinical rounds meeting with our 9 doctors. And we dive deep. We get very nerdy. We go into individualized cases. We put their scans and their exams and their case histories up. And it's just a bunch of real expert doctors, real nerd, big caring, brilliant, experienced doctors diving deep into these cases to get the best results for our patients. In our practice, PwC Chiropractic outside of Chicago, we take on the toughest of cases. We have what are called neurointensives coming from all over the world. So anyways, we get into the thick of it. About 88 minutes of that meeting is as in-depth, neurological, scientific, clinical excellence as you could ever get. But we always reserve 2 minutes for what I'm going to give you 2 minutes of here. Just our weekly favorite conspiracy theory. Come on, we're chiropractors. You know that our Instagram feeds are full of all sorts of holistic, natural living hippies and crazies and goofballs and people that stopped shaving, stopped showering, take lake showers, and just all the crazies, So we pay attention to this stuff and we have some fun with it. So let's have some fun with our kickoff to this episode with Dr. Tony's 3 favorite conspiracy theories. Number 1. It seems to be there is a conspiracy theory most commonly believed by the younger generation. Now, I'm not good at remembering who's a millennial and who's a Gen Z and who's a Gen W and who's a Gen O. I don't know. But I do know this. The younger generation loves coffee shops. They love hippie, trendy coffee shops. A coffee shop that looks like a flannel shirt that became a coffee shop location, right? And so what I've noticed, this conspiracy theory, is that for some reason, a lot of young people in the world think that in order to go sip on an oat milk latte or a lavender matcha yerba, I don't know, a latte as well, they need to wear Carhartt. Now, if you don't know what Carhartt is clothing designed to specifically perform in a very specific situation, which is called farming, hunting, outdoor, real, physical work doing. Carhartt is not designed for oat milk latte sipping. So that right there is controversy or conspiracy theory number 1 that I'm sharing with you. Now, you might be thinking, is he actually sharing conspiracy theories or just personal frustrations? Is he using his new podcast just to make these jokes and these personal frustrations and kind of weave them all into one? I don't know. You get to decide. You're the listener. This podcast is for you. So I'm calling these conspiracy theories, but they just may be, having some fun with you too. Number 2. All right. Number 2. Conspiracy theory. This one is found significantly more frequently on Instagram from moms and dads who are my age. So now we're kind of climbing the age chart here a little bit. And we're not so focused on, college students and 20-year-olds who are wearing their Carhartt, beanie and hoodie and flannel and sipping on oat milk lattes and haven't done chores in their whole life. Now we're moving on to the mid-30s to, kind of mid-40s. This is about when us suburban families reach our first midlife crisis and we either take at least, a bit of a more real move when we move out to the country, or we just go to Menards or go to Farm and Fleet. We buy a little glue it together chicken coop, put it in the backyard, buy 4 chickens, and then get a flannel shirt and some work boots, and we post on Instagram, #farmlife. Now, this one's really fun for me, this conspiracy theory right here, because I'm more the #poser farmer than I actually am the real farmer anymore today. Now, when I grew up on a farm, 800 head of cattle, 800 acres, corn, soybeans, hogs, that was a real farm. I was basically born in steel-toed boots, Wrangler jeans, and a Carhartt jacket that kept me warm when it was negative 5,000 every winter in Northwest Iowa while I'm out there doing chores with my dad at 5:30 a.m. So I have lived the real farm life, and now I've moved out to the country with my gorgeous suburban wife, and we live I don't know if it's really a real farm life. Do we have donkeys and goats and 35 chickens and 20 acres? Do we have chores? For sure. But is it a real farm? It might just be a conspiracy. And then conspiracy number 3, which will kick us right off into the topic of actual conversation today. This one's just great. It is way less than it used to be, but for some reason, we don't ever get this on Instagram because Instagram is a younger crowd. I'm really kind of running out these age generalities again here on the intro of this one. But on Facebook, a little bit of an older crowd. It definitely comes out when one of our pieces of content goes off. Invariably, here comes Karen, here comes Rick with the comment, chiropractors aren't real doctors. You should ask a real doctor what they think about autism. And I don't know if this is the tone of voice. I don't know if that's what that guy's voice sounds like when he makes that comment, but it seems like it would have that kind of tone and kind of, key to it, if you will. So chiropractors are not real doctors. That is my personal favorite conspiracy theory number 3. And by personal favorite, one of the ones that ticks me off the most, along with, oh, don't worry, they'll grow out of it. And, oh, it's just genetic. And, oh, here we go. Let's roll, because that one takes us right into the thick of this conversation. The 3 reasons why your conventional pediatrician has failed your family. Now, especially if you're working on getting to the root cause of your kid's chronic health challenges and you want them to heal naturally. You want to really address this, not just the symptoms and stuff them down, but you really want to get your kid better short-term and long-term. Man, have they likely failed you, because reason number one is they have no training. They don't even pretend almost to address the root cause. What the conventional pediatrician focuses on by far and away is symptom management, stuffing symptoms down, covering them up with drugs, surgery, medication, rather than addressing the root causes. So if we just kind of merge the intro into number 1, I got to tell you, if a real doctor is a doctor who is all stuffy, all arrogant, does not listen to the moms and dads in their practice who are asking them legitimate, research-based questions that they've done on their own. They want actual answers. They want actual explanations. And they would prefer actual informed consent, which you cannot actually give a parent informed consent if you're not willing to take the time and have the humility to listen to their questions, listen to their concerns, give them the time to share them, and then answer them in a way that makes sense to them. And if you not only skip all that, and then when it comes time to recommend your treatment, in our world, we don't call it treatment, we call it care, then you just give them medications and you give them excuses. You give them treatment that stuffs symptoms down. If that's what being a real doctor is, you better believe I am not a real doctor. And it is by very conscious, thank God every day he didn't make me one of those kinds of doctors, gratitude that I get to do the job that is the opposite of reason number 1 why the conventional system has failed your child. And speaking of the word system, we'll get to that as we merge number 1 into number 2. So here's the treatment approach from the conventional system. Conventional pediatric care always emphasizes managing symptoms, almost always managing symptoms through medication and interventions rather than addressing the underlying root causes of both acute and chronic conditions. Now, I could give you 100 different examples, but my 2 favorite ones to really illustrate how there's a significant difference between addressing root cause and just trying to cover things up with medication. First one would be, and usually this kind of shows up a little bit earlier for kiddos, which would be fever. So a child gets to their first kind of like 6, 7, 8, 9, 10 months. Their first teeth are coming in. They're getting exposed to seasonal changes. Maybe they're getting exposed to different germs, bacteria, viruses, the things that are out there in the billions and trillions, which are completely normal. And we have a pre-programmed, designed by God immune system that, yes, in our little ones who are 8 to 10 months old, that immune system still needs to develop and get stronger. And the way it will actually develop and get stronger is if when exposed to a challenge, it can overcome it on its own without medication. But if I'm a conventional pediatrician, as soon as I take my little flashlight called the otoscope and I look in the ears, they're going to be a little bit red. Actually, a lot of times there's so much wax and other things. I can't tell you how many times I've looked in the ears of a kiddo who had just come from a pediatrician or worse place. The worst care ever for a little kid is emergency room or immediate care. And they say, oh yeah, they looked in there with an otoscope and they could see that the ear, the tympanic membrane, the eardrum, it was a massive ear infection. It's all red and it's all bad. You know how many times I've actually looked in there and there's so much wax that you can't actually even get a view of much of anything, if anything, of the eardrum to actually see what's going on. So the amount of misdiagnosed ear infections is actually a problem within this problem of the example. But even if it is red, well, of course it's going to be red. The kiddo's got teeth coming in. The kiddo is going through a growth spurt. The kiddo is going through an immune challenge. And the way God designed our immune system is fever that brings about inflammation and more blood circulation to get T cells and all the good things to the battle. It's all natural. It's all good. And it's all needed. So what happens in the conventional pediatrician approach? Stuff it down with Tylenol, shut that fever off with fever-reducing medications, and then, if it's still there, here's your antibiotic for your viral ear infection. I'm not even going to give you the stats. I have them on my little outline and notes here on my computer, but the truth is this problem with pediatric care, I think, has started, like the most easily illustrated example is ear infections. Not only do antibiotics, so even if the few that are bacterial, it's because the problem, the actual root cause has been going on for so long that opportunistic bacteria have taken over and created these respiratory ear infections, nose, sinus, throat, lungs, all these things are 90%, or whatever the number. The majority of them are viral. And even the ones that are bacterial, there's actually still root causes going on that the antibiotic will not address, but actually make worse long-term. And so this is a great example of stuffing down symptoms instead of supporting the body's own natural defenses. And then the more times a child gets an antibiotic for a viral ear infection, the more that increases the likelihood of having autoimmune conditions like allergies and asthma later on. So what do kids with asthma and allergy attacks get? Steroid-based medications, corticosteroids, inhalers, nebulizers. And every time there's a sign of that illness, pull it out, stuff it in, shut it down. That goes on repeat for our kiddos in that first 1, 2, 3 years of life because the parents are trusting the pediatrician, the conventional pediatrician's recommendations of how to handle that illness. And this intersection of how to handle colic, ear infections, constipation, eczema, respiratory difficulties, asthma, allergies, this is the journey. This is a very critical pivot point of decision-making that really is dictated in most families, if you're still taking that conventional approach, by a conventional doctor who is following a conventional playbook and system, not doing anything to actually address the root cause. And what we know is the more times those antibiotics go in there, the more time those steroids go in there, and most importantly, the more time that goes on where the root cause of these issues is still not actually addressed and allowed to get worse and get worse and get worse. We call it the perfect storm in this vicious cycle. Now, by the time that kiddo is 2, 3, 4 years old, they're not only sick with their immune system and their respiratory system and their digestive system, but now their nervous system, their neurodevelopment, and their brain development is off track. And now they're struggling with sensory challenges, speech delays, missed motor milestones. And now they're heading towards an autism, ADHD, anxiety, sensory processing diagnosis. So we can look at these singular examples like colic, like constipation, like ear infections, like asthma, and say, okay, if we handle them with conventional medicine where we stuff down symptoms, there's a decision-making pros and cons to that moment in time. But there's a real long list of cons, real long list of negative side effects that pile up over time and lead to chronic disease in kids. Now, I wanted to take that real life example of ear infections and asthma and so forth, and now illustrate it not only for where this inflection point comes, but also tie it into the business of medicine. And that's the first truth expanded even deeper. The complete lack of training, the complete even attempt to address root cause with conventional medicine, it's actually the business of medicine. So with this section, I want to tell you about something you may have never heard about. And we're not going to spend a lot of time on this, but it's fascinating for how frustrating it will make you when you learn even the nuts and bolts about the Flexner Report of 1910. You can Google this, you can ChatGPT this, use Claude, whichever one of your favorite platforms you now choose to get information. But the Flexner Report is a real son of a gun, and it happened all the way back in 1910. The Flexner Report was commissioned by the Carnegie Foundation and written by a dude by the name of Abraham Flexner. Its goal was to evaluate and reform medical education in the United States and Canada. What they were saying was going on at the time is there was a lot of substandard schools that were private enterprises that were training substandard medicine, right? And there needed to be this standardization that would emphasize laboratory clinical training and make, I guess we could call this, I don't know if they used this language back in 1910, let's make sure they're all real doctors, right? Kind of playing on that fun and that parlay from before. So what happened is the Rockefeller Foundation, huge business, massive business tycoons way back in the day, they got involved and started to provide funding for this report and for this massive shift that would happen within medical school training curriculums. And I'm going to insert this word. You won't probably find this necessarily on the Google reports about the Flexner Report and the role of the Carnegies and everything that shifted in 1910, 1920. But here's what actually happened to sum it all up. They absolutely shifted the philosophy by which doctors practiced medicine. See, if you actually go before 1910, medical doctors were more like us, the root cause kind of doctors, than they are like the conventional medical doctors and pediatricians you think of today. It's naturally woven into a human DNA and just logic, like cold facts, common sense logic. We should find the cause. I always use this analogy too. It's wild. When the family pet, when the family dog throws up and gets sick, nobody goes, I bet it's genetic. What medication should we give them? The first inclination when the family pet gets sick is, what did they eat? What did they get exposed to environmentally? What messed their system up? Let's not let that happen again. And instead, the conventional pediatrician system has trained us to think, oh no, our kids are sick. It must be genetic. What medication should we give them? How vastly different is that and painfully obvious? Where did this come from? It came from frickin' 1910. It came all the way back from this Flexner Report and the massive shift in medical school training to an allopathic focus, which prioritizes pharmaceutical and surgical interventions over holistic and preventative care. The entire R&D budget of these hospitals, of the medical system, and eventually who would take over the pharmaceutical system, put a massive increased focus on biomedical research, and guess who funded it? Pharmaceutical companies, okay? So what happened is medical practice was transformed already 100 plus years ago to be commercialized, to become capitalized. It was a profit move. The influence of these powerful financial interests led to that commercialization of the medical practice, and profit became more important than patient care and patient results. The truth is, if you were to address the root cause, you might accidentally get results and get the patient better. Now, this becomes, I don't even know the freaking exponential number I want to say here. This is horrible. This is not good when you look at it as it would relate to our own health as an adult and what we would get out of the medical system or not, or what our parents and seniors would get out of it. But when we're talking about kiddos, what I got close to saying about 5 minutes ago, and I guess it's just so dang emotional I didn't finish it, is here's the truth. The more times your little one is put on antibiotics, the more times they're put on inhalers, the more times that stress, that sickness, and that perfect storm is driven into their system, the more that increases the likelihood, almost guarantees, that your child is no longer a 5-day or 10-day customer, an antibiotic or a corticosteroid script, but now they become chronically ill and dependent upon the medical system and medications. So if you change the word patient to customer, the more times that a child is given these medications and put through the perfect storm early on, they become a one-time or kind of random buyer to a lifetime, daily consumer and customer of the medical system. You can tell there's sometimes my words kind of jam up on their way out because it's kind of like the joke of the conspiracy. I don't believe in chiropractic. They're not real doctors. Do you know how bad I want to not believe that this happened? I'm a natural, happy, glasses half full. I walk around most of my life. There's plenty of grumpy people out there on life. And they, you know what? Grumpy people are going to have to go thirsty, because what I do is I find grumpy people and I take their glass, which is just so happens to be half empty, and mine is always half full at minimum. And I take grumpy people's half empty glass and I pour it into mine. Bada bing, bada boom, full glass all the time. That's a nerdy joke to say this stuff gets me right in the heart. When my teachers, when my mentors, when I went through chiropractic school and I'm getting into this real doctor world that I live in now, and I started to learn about this stuff, I was honestly skeptical. I was honestly hesitant to believe it, if you will. I had to do the research myself. That's why what I wanted to do, I did want to take 10 minutes of this podcast episode and dive deep into number one. Because if I just say to you, hey, they do not address root cause, they just stuff down symptoms. You know that. You've probably experienced that or definitely are well aware of that, but you may not know the why. You may not know the actual change in the training of medical schools, hospitals, and systems to neglect root causes and focus solely on symptom management and selling of medications. Now, here's what's crazy. This goes on. The big challenges with this approach that shifted 100 years ago with medicine is it really got rid of all diversity in medical approaches, and it pushed everything else out except for one, the pharmaceutical, drugs, and surgery world. So all of a sudden now, natural health, which did not used to be alternative, didn't used to be controversial, didn't used to be a conspiracy that you could improve the health of your nervous system, clean up your nutrition, go out and exercise, work on stress reduction, and see miraculous, incredible changes for yourself and your family. What is freaking controversial about that? What is complicated about that? What is unscientific about that? Nothing, unless someone sold you that it would be. And so they had to kick out everyone else out of the system, call themselves the top dogs, and call everyone else alternative and unscientific. There's actually been lawsuits from my profession against the AMA and the medical world that literally has proven, and the lawsuit was won by the chiropractic profession against the medical profession, and many other professions have won similar battles, or at least should win similar battles. There has been this massive business plan for 100 plus years to shift things this way, where symptom management via medication is the business of medicine, and any doctor who actually attempts to address the root cause is called a quack. And that is the crazy part. This right in front of our face, super obvious truth actually has a system behind it. And that's really the second issue here that I wanted to go through with the 3 reasons why your conventional pediatrician may have failed your family. In fact, number 2 will be the briefest one that I can cover because it's an extension of number 1. There is a system that doesn't allow them to get this done. So actually, let's just call this one 1B, okay? We'll continue it as 1B. I'm going to change my list to 3 on the fly. So 1B is this system that was created all the way back in 1910 is now also a system of efficiency. So I think a lot of doctors are actually, a lot of pediatricians would love to dive deeper into a child's case history. They would love to know more about what's really going on with the kiddo. And I promise you this, they're good people. You don't get into pediatric work for bad. You get into it absolutely for good. So I don't even enjoy this conversation. When we expose these truths, it can so often look like it's directed at a person, and it's not, or a collective group of people. It's directed at a system that has absolutely consumed these good good-willed, good-intended people. And now they do not get to practice medicine. They do not get to actually uphold their oath. They do not actually get to spend time with patients. They do not actually get to make decisions that are in the best interest of your child. They make decisions that are in the best interest of the flow chart and the spreadsheet that they've been trained to follow. Now, again, I'm not speaking conspiracy theory. I'm sharing conversations I've had with some of my dear friends from undergrad. Remember, pre-chiropractic, pre-med, all the same thing, anatomy, chemistry, physiology, so forth. So the majority, when I was an undergrad going through my genetic and biology degrees, my undergrad buddies, I was the black sheep. I was the weirdo going to chiropractic school. Oh, I was the controversial one. Now I'm the happy one. Now I'm the grateful one, because I get to address root causes with my patients. I get to sit knee to knee with my parents and their moms and their dads, and I get to actually take the time to listen to their concerns. I get to take the time to teach them the neuroscience, the neurology, the physiology, the perfect storm of what's causing their kids to actually get sick. I get to work hand in hand with them, and I'll get to step 3 in a little bit, and other providers who want to see their kids get better. I get to work in collaboration with the parents and other providers, and I get to do this thing called neurologically-focused chiropractic adjustments that facilitates and creates unbelievable changing, transformation, and health improvement in kids. And I get to do a job that I love. All of my friends, whether they're MDs, whether they're pediatricians, whether they went into different therapies, they are miserable. I've had multiple conversations with my undergrad friends who went into the business of medicine, the practice of medicine. And I'll tell you this, they're making a ton of money. They have big houses. They have nice cars. They have lake houses and boats, and they're miserable. They know the truth that we're exposing without exposing on this podcast, because it's already been exposed. The moms figured it out long ago. Well, actually, we'll go in order. Chiropractors, we've been telling this truth since 1910, actually since 1895 as well. Chiropractors were the first profession to really stand up, stand out, and not get bowled over. That's probably another podcast for another day. If you're watching this on YouTube or Instagram or something like that, comment if you'd love to hear a little bit more about the chiropractic history, because we are some tough SOBs, okay? Our practice, literally the science of chiropractic, is about resiliency and adaptability, and not saying, oh, we're not going to face any challenges, but overcoming them. Have a nervous system, have a body and a nervous system and a brain that is so healthy, so resilient, so developed that it can overcome any challenge. Yeah, you could actually use that same theory to apply it to the profession as a whole. Do you know how much medicine tried to get rid of us and anybody and everybody, natural health, not like them? So our resiliency, our fortitude, our toughness as a profession, it actually is at the highest, I think, of any other profession. And I can tell you why it's so tough. Not only does our philosophy make us live this way and roll this way even as a profession, but we are this tough for you. Because of you, because you've needed us to be, because these moms and these dads and these kids that I get to serve every single freaking day in practice, they are beat up. They're not just chronically sick, they're chronically frustrated, they're chronically ticked off, they're chronically mad that no doctor ever took the time to listen to them. Every doctor continued to dismiss them and tell them they would grow out of it. And every single doctor just gave them more drugs and more excuses and blamed genetics and didn't help them at all. So I think our profession honestly has this absolute 1000x inner drive to serve and support and care for your family. And we work our ass off to get results for your family because you deserve it. Every child deserves a life of vibrant, optimal, kick-ass health, and every parent deserves the truth as to what's going to take you off track, the perfect storm with your kiddos, Tylenol for every fever, antibiotics for every ear infection. That's going to get your child sick, and we know it, and we've known it for a long period of time. So once you study the perfect storm and you figure out exactly what causes a child to get sick, you do the opposite and you get healthy. See, the cool thing is I can actually take the complexities and the intricacies of my job in neurophysiology, and I can simplify them. And I can just say, you know what's going to get your family the healthiest? Do the opposite of what causes kids to get sick. And the spark, the catalyst of what causes kids to get sick is trusting a conventional pediatrician to make decisions and follow the recommendations and treatment strategies of a conventional pediatrician when it comes to health promotion and taking care of acute and chronic illness. Now, there will always come a time where those acute illnesses get beyond the scope of the body's ability to handle them. And when that happens, Thank the Lord that he gave us Tylenol. Thank the Lord that he gave us antibiotics. Thank the Lord that he gave us nebulizers and steroids and pediatricians and medical doctors and hospitals and the pharmaceutical system. See, I'm a bit of a weirdo in this way. I actually love them both. Now I know if you just run this whole podcast episode, you kick out the transcript, run it through ChatGPT, and you ask AI, hey, is this guy like the conventional medical system? The AI might not even pick up on the truth, which is yes, when used appropriately. They are the alternative. They should be the last resort. And there will be many life-saving, tough situations that our kids, our families will go through where they will save lives like only they can do. Only their training can do that. They are the fire department. They are not the restoration and home building experts. And so the truth is that system is the one that takes over. That's why they don't have the training. That's why they don't have the philosophy. They don't have the skill set, and they don't have the time to actually listen to you and actually work in collaboration with you and other providers. And that is why they behave, if you will, like they do. So that's point 1A and 1B, which drives us into point 2. Reason number 2, the conventional pediatrician has very likely failed your family, is they actually have little to no training in neurology and neurodevelopment. Now, you may be thinking, and this one people may listen to and be like, that's crazy. They're a pediatrician. They have to understand milestones and development. They do, on a very rudimentary, very basic, and I'm actually going to use this word to really illustrate my point, in a very obvious pathological level. What a conventional pediatrician, and honestly, even a conventional medical neurologist, is able to do is find the obvious. I tell this to parents all the time who have especially been through the pediatrician and the neurology world for missed milestones, neurodevelopment, neurosensory issues like autism, epilepsy, ADHD, and so forth. And here's what the pediatrician's tracking of milestones are. There's a poster or a chart somewhere on the wall. There's a questionnaire you fill out in the paperwork, and they maybe do a few tests to move your kiddo around the room, and they either check the box, made it, or didn't. Now, if you talk to any actual expert in neurodevelopment, especially movement-based development and motor milestones, like a pediatric chiropractor, a pediatric PT, OT, or speech therapist, anybody who works in the early intervention world, which is I've spent my whole career specializing in early intervention, and it's just not just chiropractors, but all sorts of providers of other initials and other expertise in the early intervention world. I used to think that I was the most frustrated human in the world with conventional pediatricians in the medical system. And I now know that the ranking system goes like this. Number 1, most frustrated people, parents, moms who continue to be dismissed, not listened to, and given treatments that they feel forced into instead of informed and empowered into. Yep, I said it because that's what happens. Number 2, group of people that are most ticked off and frustrated with the conventional pediatrician system, and when they miss these milestones and obvious markers of trouble brewing in a child's brain and nervous system, is early intervention specialists, PTs, OTs, speech therapists, developmental therapists. Everybody in that system is so frustrated by how long it takes for a conventional pediatrician to find these neurosensory and neurodevelopmental challenges in a kiddo until it almost smacks them in the face. And then they make the referral. And then that provider is late to the party trying to address the real root cause of what's going on with that kiddo. And at least those folks, PT, OT, and speech, they get referrals way late, 11th and 3/4 hour usually, after the trouble has already been brewing for that kiddo. But at least they work somewhat in conjunction with the traditional system. We are still on the outside. So often, until the internet, until podcasts, until these things that we can get the word out to you, for many of you families, for many of you still today, and I promise I will change this for our kids. I promise you that in the middle of this podcast episode, I will work everything I've got every day till the Lord takes me up there, and I will take us as far as possible so that pediatric chiropractic and the real doctors who get to the root cause, because I'm going to get to this next about the nervous system, you can't actually get to the root cause until you address stress and what's called subluxation, dysregulation, dysautonomy on the nervous system. That is chiropractic only. Even these other amazing providers, they don't even do that. I will not stop until pediatric chiropractic is the first choice, first stop, first call, foundational place you go for health for your family, instead of what has probably been happening, or maybe with this episode right here, is happening in real time for your family, where this feels like the last resort, the last choice. How did I not know about this before? Because once you map this all the way through and you understand what neurologically focused chiropractic does and how really foundationally, fully, more than any other profession out there, we address the root cause and understand actual neurodevelopment and neurosensory function better than anybody else out there, you understand that the conventional path would have been your last choice, the last resort. And these things, neurologically focused pediatric chiropractic, movement-based therapies like PT, OT, speech therapy, natural health care that works on diet, nutrition, and lifestyle and environment, those would have been your first choice. The reason that so many of us families and parents of this generation feel like we're late to the party and we have to now start to do things in reverse order than what got us here and led to our kids getting sick is once again, slide back up to my outline in this episode. Reason number one, we got selected into that system by default. We were told by our parents and their grandparents that you trust the doctor, you trust the pediatrician, you trust the system. Well, they've actually done surveys on this. Gallup polls now show that medical doctors, every single year that this poll comes out, the trust that we have in doctors and in the medical system is plummeting because really imagine we're on a sky. I know I'm on a podcast, but imagine my hands are going in a different direction. Our trust is rightfully going down because our understanding and finding the truth about the system behind it, again, the people, wonderful. The system, yeah. So as that awareness and that information about that truth goes up, our trust goes down. But here's the final thing I really want to turn the corner and bring this podcast almost home with. We got one more point, and that will actually get us home, is when we find out, what do we do? When we don't want to go in that direction anymore, what direction do we go in? That's why we built this podcast. That's why we built the Pediatric Experience platform, the PX Docs platform, because I know that number one, you got to find out this truth first. You got to become aware. Big fan of awareness, massive fan of information. But I am not a believer, just run that joke out one more time, in the old quote that knowledge is power. No, it's not. The implementation, the ability to take action from learned knowledge is where power, where results, where transformation comes for your family. And I'm telling you, I'm one more point to go before I finish my 3 reasons, but I'm going to get to the call to action right now because it just feels like the right time to do it. You need a new doctor. You don't need to go this new direction on your own. And right now, I'm probably going to speak right to the heart of a lot of you moms and a lot of you dads out there where you feel like you've been navigating this natural, holistic, searching, praying, Google scrolling, Instagram expert following, Facebook group by the hundreds joining path to try and find the root causes of your child's challenges. And you've probably felt mostly or entirely alone the whole time on that journey because you know you can't ask those questions in the conventional system and you don't know who to ask them or who to trust outside that system because they've eroded the trust from you to us and to others. It's time to change that. There is an enormous amount of science behind neurologically focused chiropractic. There's an enormous amount of science behind integrated and functional medicine. There's an enormous amount of science behind things like essential oils and supplementation and lifestyle intervention. And it works. It works wonderfully. It doesn't work overnight like medications. It doesn't work as easily like the pharmaceutical and medical system does, but it does work over time to facilitate real, actual healing by addressing the root cause neurophysiological imbalances within your child's system. Now, you need a new doctor who can not only make adjustments and provide care that sparks and facilitates that, but just someone you can trust. Trust them with your questions, and you can trust them with reason number 3, to build a partnership and build collaboration. The coolest thing, and again, I'm kind of done with sharing my frustration, but I feel like there's one more layer. I've been in this community for 16 years, serving thousands of patients who have experienced, we wear this shirt all the time. It's actually one of our taglines, Experience Miracles. That's the name of the podcast, the Experience Miracles podcast. Miracles in kids are loud because it's our kids' health that has been transformed. Miracles in kids are loud because moms, you are loud. You share everything, good, bad, and everything in between, but you share the good, the loudest, and the mostest. So I know that in my community, Crystal Lake, Illinois, in this county, I know for sure, unequivocally, this is not a theory for me. I know that virtually every single pediatrician, I don't know how many there are, but I know that virtually every single conventional pediatrician in this community, this county, and this area has heard about pediatric chiropractic, has heard about Dr. Tony Ebel, has heard about PWC, has heard about PX Docs, and has had a real life sitting in front of them. Go ahead and do the exam and check yourself. Child and mom and story say, hey, you know how we were getting chronic ear infections and it was tons of antibiotics and then ear tubes and yada, yada. And we just went from ear tubes to asthma. And then you gave us corticosteroids and inhalers and medications for that. And then those caused my child to be exhausted and wound up all the time. And then ADHD. And then you gave us a referral and a medication for that. Yeah, you know how our kiddo was struggling with all that stuff? Yeah, we went over here. We got adjusted and we went to a chiropractor and it's all gone and he's all better. Would you like to learn more? I know you moms have this conversation. I know some of you don't because you probably save your breath because you have met and gone in that office enough times to know your doctor, your conventional pediatrician. If you brought this conversation up about natural health, neurological chiropractic, and the amazing freaking transformational results you've got, you'll still be dismissed. And that still happens today. So the third reason why your conventional pediatrician has failed you is they refuse. I don't know any other freaking word to share at the end of this one. They refuse to collaborate with anyone else. They refuse to leave the silo of conventional genetic theory, germ theory, which are all just, not even close, bro, theories. And they refuse to step outside and work alongside other providers, practitioners, and most importantly, parents who are addressing the root cause and facilitating and creating actual healing in a child's nervous system and physiological system. So what they do is they put up their guard and they say, I haven't seen the research. Well, where's the research behind antibiotics for ear infections? Where's the research behind the chemical imbalance theory for ADHD and anxiety and depression? Yeah, you can't call the kettle black. It's a straw man argument that simply they regurgitate generation after generation, year after year, doctor after doctor, school after school. You better believe that change in medical school curriculum has absolutely taught them how to communicate and dismiss you, dismiss us, and dismiss everyone but them. But here's the shift that is occurring, and here's the close of our conversation today. It's up. We know. We're there. We need them. We need them to put out fires. We need them to save lives. You absolutely want a pediatrician. I would switch you from a conventional pediatrician to an integrative, holistic pediatrician. I'm going to give you some exact action steps to close this thing down, some questions to ask your doctor to find out. Listen, you getting on board? Choo-choo. Here we go. Yeah, I did that. I just did that on a podcast. I probably wasn't supposed to do that. That's pretty lame. But I'm a pediatric doctor and a dad. So I have dad jokes and neurology, and I'm not that cool anymore. I'm freaking 42. All right? And so, okay, I did that. I can't take that back. I could ask my team to edit that out in post-production, but I think you guys know me by now. If you've even listened to one episode, I'm just kind of okay with the lameness, okay? And so, moving on here. Okay, so the train is moving down the tracks. You and your family and your child, you're going to heal. And I want you to feel me, not just hear me at the end of this podcast episode, mom and dad. God put you as your child's parent to be their advocate, to be their warrior, to build resilience. And that resilience may come through many nights of frustration, many nights of tears, and many nights of prayers, and many nights of Google searches and podcast searches to find someone like me, to find a podcast like this so that you can finally move in the direction you've long wanted to, which is to address the root cause without drugs, find a doctor who will work and partner with you, listen to you, give you answers, give you explanations, make things make sense that never did before, and make them simple and make them actionable. You deserve that. That is what makes you your child's hero. And so what I would say is you decide that every doctor on your team gets on board with that train because you're the freaking conductor. We'll just run it from trains to planes. You're the pilot, okay? We are not, I tell my patients this all the time, the worst kind of doctor you could ever want for your child is a dictator doctor. The doctor you want for your child is a co-pilot, a coordinator, a partner. That's the kind of doctor I love to be with my families. Am I good at coordinating and calling plays and seeing how healing happens? You better believe it. So our families trust us. They trust our intentions. They trust our integrity. They trust our science. They trust our adjustments. They trust our philosophy. They trust our approach because it aligns with them. So that's all I'm asking you to do at the end of this podcast. Does your current doctor align with your family's values, wishes, and intentions? What your doctor also won't tell you is that what's taking over in the healthcare system for what is called evidence-based medicine is evidence-informed healthcare. And evidence-informed healthcare has 3 prongs, and one of them is you, patient preference. I hope you're smiling right now at the end of this podcast episode because this is what doctors should be telling you. What do you want to do for your child? What is your gut instinct as to what's going on? Now, that doctor shouldn't just sit back and have nothing to do. That doctor shouldn't just sit back and say, I don't know anything, I can't help. Heck no, don't take this too far. That's not where I'm going with this. If people are trying to pick apart that doctor knows what to do, but you also know best. In 16 years of clinical practice, the thing I trust the most, yes, I trust my training. Yes, I trust the science that I study every single day. And yes, I absolutely trust my own clinical experience. I've got a ton of it. But I trust moms and dads. I really lean in to their instincts. I really lean in to their questions and their concerns. And I really lean into the direction that they are taking their family to facilitate and create healing. So here's the list. Here's the questions I would ask of your doctor. And by the way, give them a chance. You know what we need to change? You know what will transform the health of millions of families? If individual doctors transform their approach and they don't leave the system, but they update the system. I'm extremely passionate about this. Maybe there's a part 2 of this conversation where we can actually get into the strategies. I have many friends who have just resigned to the miserable existence they have in the medical system and they're not ever going to change. And I have many friends, you've already heard from one on this podcast, Jessica, who was trained conventionally and now has the greatest integrative, functional, pediatric and adult practice and really transforms lives of kids in our community. And we need more Jessicas in the world by the freaking hundreds of thousands. So I want you to go even to your conventional pediatrician. And here's your list. Here's your list of questions that you kind of ask yourself about them. And some of these, you can even go ahead and ask them in a way. Number 1, do they truly, actively listen to me? When I'm bringing up questions, when I'm bringing up concerns, and I legitimately have these concerns and questions, do I feel heard? What our main office coordinator, chief hope dealer on our team, Jackie, talks about, she has been on this podcast as well. Her podcast episode was transformational. Go listen to that with Logan and Luke's story. But Jackie says, we believe moms here. We listen to moms here. And that is exactly what we do. Number 2, are they looking for the real root cause or just turning to medications and kicking the can down the road to genetics, other medical specialists all the time? So if they're not looking for the real root cause, is that the doctor you want to continue to trust? Number 3, do they understand the role of stress, subluxation, sympathetic dominance, dysregulation, vagus nerve dysfunction, dysautonomia, and the perfect storm on the nervous system and how it very likely is a root causes of your child's condition? Now, I ripped off a bunch of neurological terms there, but if they don't even understand the basics of neurodevelopment and neurosensory function and subluxation and sympathetic dominance, if you get into this conversation and these terms and these things that you've learned here on this podcast, if you want to learn more about those, go to our website, www.pxdocs.com, and you'll find our foremost articles are about those neurological scientific terms. Go learn more about those. And if your doctor doesn't know about those, then they're not updated and they don't really understand what the root cause of illness is. It goes way beyond gut issues. It goes way beyond the microbiome. It goes way beyond primitive reflexes. It goes way beyond tongue ties, and it goes way beyond gluten-free, dairy-free, and getting rid of toxins. Our kids' nervous systems are stressed all the way back to pregnancy, labor, and delivery. And I didn't really teach that stuff on this episode, but I want you to go forward. I want you to go all the way back up. You can just listen to the Perfect Storm episode. You can listen to episodes where we get into this science. If you're hearing this episode for the first time on our podcast. I teach that neurology via other episodes, and I'm sure there'll be more coming down the pipe as well at an unheard of level. And that is stuff you need to know, and you need your doctor to know that stuff. So ask them those questions. And then the fourth and final question is, are you willing to work in partnership with us as parents and my other natural, holistic, drug-free, root cause obsessed providers to get optimal results? My take for my family, if the doctors and the providers on my kids' team don't go 4 for 4, if they don't really listen to me, if they don't really look for the root cause, if they don't really understand the role of neurology and stress on the nervous system, and they don't work in partnership and collaboration with the other doctors and providers I bring on my kids' team, for me, this list is a required 4 for 4. And I'm finding a doctor that is 4 for 4, bats 1,000, and that's who I trust to lead my family out of the storm. If you found this podcast and your kids are sick and your kids are struggling and your kids have chronic illnesses, you need a doctor who crushes all 4 of those to lead you, guide you, and provide care to get your kiddo out of that system. Those doctors on our website, www.pxdocs.com. If you don't think you have a doctor like that, go to our website, go to the Find a PX Docs tab. That's our directory tool and our plugin. Put in your city, put in your zip code, and find one there. That's exactly what nervous system focused family chiropractors do. If for some reason we're working as hard and as fast as we can to train thousands more chiropractors and get them on that directory all over the world, if you go there and you don't find somebody, your town, your city, your county, your state, your country, will you send us a DM? You can do it right there on the website, or you can go to our Instagram. So find us on Instagram at PX Docs. Find us on YouTube at PX Docs. Find us on Facebook, Dr. Tony and the PX Docs. I always joke that sounds like a bad chiropractic folk band when you say it out loud like that. But go on one of our platforms or go right there on the website and send us a message. And you can get our help finding a doctor like this. And lastly, please subscribe to this podcast. Please rate it. Please share it. Please blast it out to your mom networks and your other provider and parent networks, because this is the podcast that is going to transform the health of generations to come. And when you whittle it all the way down, which I should probably use the word whittle on every single podcast episode because it's an awesome word. And when you whittle it in, see, I used it, I stretched, I reached there, didn't I, for the use of the word whittle. But now I get to use it one more time. When you get it into the message at the very end, but when you whittle down everything we do with this podcast, we've actually got one action item we are always praying, planning, and hoping you take, which is to get that hope dealer, that root cause finder, neurologically focused pediatric and family chiropractor on your team, leading the way out of the storm. Or even better, maybe we found you ahead of the storm or early in the storm, and leading your kids and leading your family ahead of it so you don't get pulled into it. Because the conventional pediatrician path is one that works its finest when you're stuck in it. It's not designed to get you out of it. You have to take this new approach, which should really one day, the whole plan, the whole shift, the whole vision and mission I have for future generations, my kids' generation and my grandkids' generation, is that this new thing, pediatric chiropractic, won't be new at all. It'll be the thing that families, millions of them, for years and generations to come, goes to first, because it aligns with exactly what gets results, and it aligns exactly with our core values and the wishes, the goals, and the desire we have as informed, empowered parents. That's what this podcast is for. We will empower you. We will inform you. We will inspire you. Hopefully, I'll sneak in 1 or 2 dad jokes that is at least half decent and gets you to laugh. So please share the heck out of this podcast. Please rate it. Please review it. Please leave a comment, especially if you find the jokes funny. I would love those comments too. That makes me feel good inside. That's good for my HRV and my adaptability. If at least one of the 10 to 12 jokes I try per episode lands, if you resonate with the card heart and the oat milk latte thing, like if you grew up on a real farm too, you can go back to the beginning of this podcast episode and you can listen to that one again, because that was a good joke. I feel like, halfway. Love y'all. See you on the next one.